I'm sitting here wondering now, but I think we need to give the opportunity for you also to ask your questions. Issues about frontline and who the frontline person is one of the issues I would also ask if it is not asked. And then isolation centers. You know that issues about situating an isolation center. We've had cases on the Spintex Road, for instance, and then also now in Pram Pram, the residents are up in arm against the Ghana Football Association for giving out their facility for it to be used as an isolation center. Really, if an isolation center is set up in a particular area, does it mean that there's a possible spread of the virus? What really does it mean? What kinds of danger does it pose when an isolation center is set up in a particular area?
Okay, so basically, I think the communities, the individuals should begin to understand what is happening. Mm-hmm. And we will need a lot more community engagement and social mobilization for all of us to understand the need for some of these activities. Truth be told, we cannot manage all the cases in hospitals. Okay. We've all seen what is happening elsewhere. And it is not all cases that, technically speaking, ought to be in the hospital. I'm sure we'll go into the various bits as we go along. But generally, the risk levels would not be in the community. Okay. It is rather to take away those who pose the risk to all of us in the community to the isolation center. So the isolation center technically actually takes the risk away from you. Because if the ill patient or the asymptomatic patient who is walking around is not sent in there or is not kept at home in proper self-quarantine, and we have come to realize that most of the people are not really adhering to the rules of the self-quarantine. So then, if we don't take them into the isolation centers, these individuals will be in the community and they will be spreading the virus. Okay. So technically speaking, the isolation centers are supposed to protect us. But of course, people might not have so much in terms of the understanding of the workings of these things. So they may think that the moment an isolation center is found in your community, then what it means is that everybody is rather going to be exposed to the virus. Okay. It is rather the reverse. If anything at all, the disease, the sick patients, everything else around it is rather contained in that isolation center, where the health personnel will be working, and then they will have to deal with the issues as they come. The mode of spread of the disease is primarily by contact. So the droplets from the infected person drops within a small radius, and then those who get into contact with that are the ones who are going to ultimately pick it up, and then it moves towards their faces and goes through the openings around the face, so your eyes, your nose, your mouth, you know, stuff like that. So rather, when they are in the isolation center, they are actually there to protect all of us. And people should not be extremely agitated and opposed to citing these centers in their localities. The public health system wants to protect all of us. We are not doing this to rather compound the situation. No. If it poses a health risk to the community, the public health or the country's health system will not bring a patient into that community. We cannot also move all patients from home to the hospitals, as I said. And we cannot also move all patients from home to few designated centers, because the centers are naturally overwhelmed at this moment because of the numbers that are coming up.